Corey, thanks for sitting down with me today. Maybe to start with, just introduce yourself a little bit and your organization.
Sure. So Corey Feldman, not the 80s actor, sorry to disappoint. Protego Health is using AI and automation to prevent denied medical claims, and where that's not possible, to automate the process of appealing denied medical claims.
When we first spoke, you're a relatively early stage company, really great solution for a real big problem that exists in healthcare. But as an early stage founder, tell me a little bit about what attracted you to work with Connex.
Sure. So, the best ideas are effectively useless if you can't get them in front of your potential customers. And one of the main challenges for an early stage founder is that you have a million tasks to do in 24 hours in a day. And one of the most time consuming things is getting your idea and solution in front of those potential customers. And so when I met you and understood the network that you've been able to build over these past 17 years, it was really appealing to me to not only be able to get in front of that network, but to solicit the feedback of yourself and Andrew, who really deeply understand the pain points of your network, to help us make sure that we were running in the right direction and not traveling down a road that was not going to be fruitful.
Yeah, I'd like to talk about that a little bit, because that positioning and messaging work at the beginning of what we do, and obviously it's ongoing, of course, that's particularly important, I think. But from your perspective, how have you found that experience? How have we helped you?
Well, first of all, working with the two of you is great, because you each have different skill sets and you complement each other in different ways. But I feel fortunate that I got to spend a good chunk of time with each of you in the very beginning, and whether it was revamping our marketing and thinking about how the way we spoke about ourselves was going to resonate or not with the market, or how to succinctly describe our value proposition in a pitch, which you and I worked on a lot. I think each of you brought different things to the table and really helped us feel confident that the message that we were bringing to the market was one that was going to resonate. So I felt like you each contributed at different portions of that process.
Yeah. Obviously, it's relatively early days in the relationship. I think we've only been working together, three months or so.
Yep.
The meetings and referrals you've had from us so far, how have they been?
Great. Frankly, we are swinging for the fences, right? And so we're speaking to large organizations, but they come to us pre-qualified, right? These are folks who have this problem and are looking for a solution to it. You have been great about getting us some background information that makes sure that we're walking into that call with a decent overview of their present state, and it makes the conversation so much more productive to have gotten all that out of the way and basically come in and say, here's what we think we know about you, here's what we do, let's talk about the potential synergies. So many of the conversations that we started thanks to your introductions are still ongoing. We've certainly gotten in front of far more potential customers during this time period than we ever could have hoped to without a partner like yours. Even if we had a full-time VP of sales, he or she is not going to have those relationships across such a large group of diverse health systems, large provider groups. And you've also been able to cater the types of customers to the ones that are at present kind of the best fit for what we do. So it's really been invaluable.
Thank you. Yeah. I want to touch on something you brought up there, which is the specific market that you want to go after, because obviously as a founder, you have to be really focused, right? To start with and say, okay, who's going to buy my product, right? And build your business that way. For you, obviously that starts off being physician groups, large physician groups in particular, but the hospital market is also super important to you in the sort of medium term, and beginning to get that feedback from them is super important. So let me to talk a little bit about how we sort of helped you do that, because I remember a conversation we had where I sort of said, well, how about having your cake and eating it, right? And the idea of you want to be talking to, of course, those short-term customers, but also to or quicker customers, but also the people that ultimately are going to be the largest potential customers for what you do.
Yeah, if you think about what it would have taken me to get in front of the types of people that you've gotten in front of us, VPs of revenue cycle for these large health systems, tens of thousands of dollars of investment in conferences, meetings. These are not people that are necessarily going to answer a cold email, right? And the manpower that it would have taken is not time that I think would have been well spent at this stage given our present market. But because of the way you've been able to bring them in front of us, it has reduced the investment I've needed to make to have those conversations and start to paint a picture of what's important to them. And as it turns out, they really do aggregate tons of the type of denials that we are already equipped to handle. With health systems comes the questions of integration and how well you play with Epic, Cerner, and some of the other parties, which will become relevant to us in that medium term. But even being able to start to envision what that looks like and how we can fit into their workflows, which are obviously quite different from physician billing workflows, to your point, has really helped us to think critically about our roadmap and how we bring this solution from where it is today, where it's helping physician practices, to eventually helping health systems and hospitals as well.
And one of the things I've observed from you, the meetings you've taken, and then to some of the conversations we've had, and talking to Tal, who's your co-founder, is how you're evolving the product through the conversations you're having and what you're learning in those conversations, and sort of that roadmap of where you want to take it.
Yeah, there's a kind of an interesting dichotomy in innovation where if you just listen to what the customers ask for, they ask for better versions of the same things that they have and know. So some of innovation requires thinking outside the box and not building a faster horse but a car, right? And having a team in-house that actually does revenue cycle has allowed us to observe some of those behaviors and shortcomings and think in that innovative and creative way. But there's also the need for that institutional knowledge of what is and the systems that folks are working inside of. And I think getting to speak with, in some cases quite freely, revenue cycle leaders within the health system world, based on your close relationships with them, has helped to illuminate for us like where that innovation can occur, the guardrails, so to speak.
Yeah. And then sort of the last thing, obviously the sales conversations we've talked about, some coaching and things just about how you show up in those conversations, how to use the information, for example, that we provide ahead of time, because it's a bit unusual, right? You know quite a lot about these people before you even meet them. Talk a little bit about that, if you would.
Yeah, I think you have pushed us, rightfully so, to be as data-driven as possible and to really seek out the metrics that define success, whether it's for an internal team that's doing billing or for partners that we're working with, and trying to quantify the value and the ROI. And the easy thing to say is, well, we're not there yet, we don't have it. The harder thing to say is, okay, but you do have something. How can you look critically at what's in front of you and start to turn that into numbers that people can wrap their heads around? So I think you have made our pitch and the way we speak about ourselves more mature, and I think allowed us to portray ourselves in a way that will resonate more with the market than it might have had we not undergone these various conversations.
Last question, objectives. And again, it is early in our relationship, but what are your objectives for this relationship? Where did you expect it to go to start with 3 or 4 months ago, and are those expectations the same, more or less?
Well, you guys have certainly got us in front of far more customers than I could have envisioned we would have by this stage, and so I would want and expect that to continue. I mean, the expectation is that revenue and partnerships will come, but really that's kind of on us, right? You can bring a horse to water, right? It's about us making sure that we're listening to what people are saying, incorporating that feedback, and coming back and saying, this is what we now have, you said this is what you need, and making sure that that we are building for the market that we are in constant conversation with, thanks to your introductions. So it's really like a team effort to make sure that this relationship is a fruitful one. But on your end, if you can continue to provide these introductions and then back channel and really get the inside scoop on what they felt like was great, what they felt like was missing, so that we can help to build to that end state, I think that will lead us to a place of mutual success. And I've been really excited and grateful for the introductions and the relationship so far, and really looking forward to continuing it.
Awesome. Well, thank you for sitting down with me.
Sure. Thanks for having me.
Thank you.